Hello everyone, my name is Ahmed Al-Tarifi, and in this presentation I will talk about principles of autonomic nervous system pharmacology and some introduction that is important to understand the drugs that are related to this important system in our body. The outline of this presentation will include the classification of the nervous system in general. Then we will talk about the anatomical structure of autonomic nervous system that is important from pharmacological point of view. Then we will talk about the outcomes for the activation and inactivation of sympathetic and parasympathetic nervous systems, which are the two limbs of the autonomic nervous system. And finally, we will talk about the receptors for both systems in the autonomic nervous system. All the discussions in this presentation will be clinically oriented and will help the observer to understand this important subject for future drugs that we will talk about in other presentations. Nervous system is classified into central and peripheral nervous system. The central nervous system includes both the brain and the spinal cord, which is not in the interest of this presentation. The peripheral nervous system, on the other hand, is classified into afferent nervous system and efferent nervous system. The afferent includes the nerve that transmits the signals from the periphery of the body toward the central nervous system. On the other hand, the efferent nervous system transmits signals from the central nervous system toward the peripheral nervous system. The efferent system in turn is classified into somatic nervous system and autonomic nervous system. The somatic nervous system is the system that involves the transmitting signals toward the skeletal muscles, or the neuromuscular junction, where the nerves coming from the central nervous system going into the skeletal muscles, which are voluntary muscles. On the other hand, the autonomic nervous system are involuntary neurons, and also they transmit the signals from the central nervous system toward involuntary structures, including the heart and smooth muscles in different tissues in our body. The autonomic nervous system is classified into both sympathetic nervous system and parasympathetic nervous system, which are the two main systems that we are going to talk about in details in this presentation. This slide, although simple, it shows a lot of important information that differentiate between sympathetic and parasympathetic nervous system from anatomical point of view. Both of them are originating from the central nervous system, as we see here, and both of them usually innervates the same organs. So an organ such as the stomach or the pupils or the heart receives innervations from both systems. Now both systems, as we can see, consist of two neurons. So it's called preganglionic neurons and postganglionic neurons. And again, in the parasympathetic nervous system, preganglionic neuron and postganglionic neuron before they interact with the target organ. Also, we can see here that the preganglionic neurons of the parasympathetic nervous system is longer than the preganglionic neuron in the sympathetic nervous system. And the opposite is true regarding the postganglionic neurons, which is longer in the sympathetic nervous system. Finally, this slide also shows some of the neurotransmitters that are involved in transmitting the signals from the central nervous system to the target organs. Between the preganglionic and postganglionic neurons, we can see that acetylcholine is the neurotransmitter in both sympathetic and parasympathetic nervous system. For the neurotransmitter to transfer the signal from the postganglionic neurons to the target organs, it's acetylcholine in the case of parasympathetic nervous system, and mainly norepinephrine in the case of sympathetic nervous system. Please remember this information. I'm saying mainly because we have one exception for this. This is a more comprehensive graph of what we just said in the previous slide. This is somatic nervous system that targets mainly the skeletal muscles, and down here it's the autonomic nervous system and its two major divisions, sympathetic and parasympathetic nervous system. We can see both of them can innervate different internal organs such as the heart and blood vessels. In the parasympathetic nervous system, we have long preganglionic neurons where acetylcholine is released and synapse with the postganglionic neuron in an area called the ganglion. The postganglionic neuron then sends its short axons toward the target organs. In the contrary, the sympathetic nervous system has short preganglionic neuron axons, but also they release acetylcholine into the also what's called the ganglion, where it synapses with the cell bodies of the postganglionic neurons, where they have long axons to target again the organs in the viscera. The major neurotransmitter for the sympathetic nervous system is norepinephrine, and the neurotransmitter in the parasympathetic nervous system is acetylcholine. Now we have an exception in the sympathetic nervous system where the preganglionic neuron go and target the adrenal medulla, where themselves behave as a ganglion. So the preganglionic neurons will release the acetylcholine as a neurotransmitter, and they will bind to the receptors into the adrenal glands, and that will activate the adrenal gland to secrete their contents of epinephrine and norepinephrine into the blood vessels directly, where they can produce effect in human body in general. This table is one of two tables in this presentation where it compares between sympathetic and parasympathetic nervous system in different dimensions. So the sympathetic nervous system arises from thoracolumbar area, which is specifically T1 to L2. However, parasympathetic nervous system is craniosacral because some of the parasympathetic nerves arise from the sacral region S2 to S4 and from cranial nerves, which are number 3, 7, 9, and 10. Now, the discharge of sympathetic nervous system is usually generalized, so most tissues, once the sympathetic nervous system is activated, will be affected by that system. However, in the parasympathetic nervous system, usually a system can be activated while other systems are not. The sympathetic nervous system prepares for the body for the fight or flight response, while the parasympathetic nervous system is for rest and digest. Usually, in normal day, the parasympathetic nervous system is dominating unless there is a stressful condition where the sympathetic nervous system starts to prepare the body for the fight or flight response. As we mentioned earlier, the preganglionic neurons are short in the sympathetic nervous system compared to the parasympathetic, and thus the ganglia will be closer to the midline in the case of sympathetic nervous system because of that short axons of the preganglionic neurons, and they will be close or within the effector organ in the case of parasympathetic nervous system, and that indeed will make the postganglionic fibers for the sympathetic nervous system longer than the postganglionic fibers in the case of parasympathetic nervous system. As it was mentioned earlier, acetylcholine is the neurotransmitter between the postganglionic neuron and the effector organ, while norepinephrine is the main neurotransmitter between the sympathetic nervous system and the effector organ. This slide also summarizes some of the concepts that we talked about in the earlier slide. On the right side, it shows the organs that are targeted by the parasympathetic division of the autonomic nervous system, and in the left side, it shows the organs that are innervated by the sympathetic division of the autonomic nervous system. We can see that our many organs can be innervated by both divisions. We can see the heart here, for example, and this here. We can see the GI tract here and in this side as well. However, some organs are only innervated by parasympathetic nervous system, and some other organs are only innervated by sympathetic nervous system and I will mention two examples. The first example, where ciliary muscles in the eyeball are only innervated by the parasympathetic nervous system, and these muscles are important for near division, or what we call the accommodation. On the other example, we have the sweat glands, which are only innervated by postganglionic fibers from the sympathetic nervous system, and they do not receive anything from the parasympathetic nervous system. This slide also shows that the sympathetic nervous system arises from T1 to L2, so that's why it's thoracolumbar, and the parasympathetic nervous system arises from the sacral region and the cranial, some of the cranial nerves. That's why it's called craniosacral divisions. In continuation with the previous slide, this is the second table that compares between the sympathetic and parasympathetic nervous systems. So as we mentioned earlier, the sympathetic nervous system arises from the thoracolumbar area, while the parasympathetic is from craniosacral. Specifically, sympathetic comes from T1 to T12, and then L1, L2, and sometimes L3, which is lumbar 1, 2, and 3. The parasympathetic comes from the four cranial nerves, oculomotor, facial, glossopharyngeal, and the vagus nerve, plus from the sacral part S2 to S4. For the effects, sympathetic nervous system is fight or flight, while the parasympathetic sometimes they call it rest and digest, or feeding and breathing. Now let's come to the effects of these systems on different organs and systems in our body. For the respiration, sympathetic will decrease secretions and produce bronchodilation. So they widen the bronchial tree and make breathing easier. The opposite will happen in the case of parasympathetic. It will increase secretion and produce bronchoconstriction. Secretions in general, which include salivation, lacrimation, and other secretions, it will be decreased in the sympathetic nervous system, while it will be increased in parasympathetic activation. In the heart, the sympathetic nervous system will produce what we call positive inotropic effect, positive chronotropic effect, and positive dromotropic effect, which means increase in the contractility and increase in the heart rate and increase in the electrical conduction in the heart electrical neurons. In the parasympathetic nervous system, they will produce exactly the opposite, so they will decrease the contractility and decrease the heart rate or bradycardia and decrease the electrical transmission in the heart. In the blood vessels, sympathetic produce mainly vasoconstriction, while in the parasympathetic, although they do not directly innervate the smooth muscles in the blood vessels, but they can produce vasodilation through a second messenger, which is the nitric oxide. In the sweating part, sympathetic is the only system that innervates the sweat glands in our body to produce diaphoresis or perspiration. The parasympathetic has no effect on sweating themselves. In the eyes, sympathetic produce mydriasis or widening of the pupils, while the parasympathetic, they will constrict the pupils or meiosis, as well as they will help the ciliary muscle to accommodate for near vision. In the GI tract, sympathetic nervous system will decrease the motility but increase the constriction or the sphincter contraction. So in general, they will produce constipation, while in the parasympathetic nervous system, it will produce the opposite, where they increase the motility and decrease sphincter contraction, which may lead to increased bowel movement and diarrhea. Now, one thing I want to mention here is that, and that's why I put the effect of sympathetic on sweating in red right here, okay, that the sympathetic nervous system is the only system that innervates the sweat glands, plus this is an exception of the case of neurotransmitters used in the sympathetic nervous system. As we mentioned earlier, the the postganglionic neurons that innervate the tissues in the sympathetic nervous system, they release norepinephrine mainly. This is the only exception we have for the neurotransmitter that's released from the postganglionic neuron, where the neurotransmitter in this case that connects between the postganglionic sympathetic neuron with the sweaty gland is actually acetylcholine, which is considered the main neurotransmitter in the parasympathetic nervous system. So all these effects right here in black, as well as here, is done by the norepinephrine, but this effect of the sweating after activation of the sympathetic nervous system produced by acetylcholine, and all effects of parasympathetic nervous system here to the effects produced tissues by mentioned in the previous slide. Here we have more examples of these effects. So for example, the effect on male reproductive system, the sympathetic nervous system is the produce ejaculation, while the parasympathetic is there responsible for the erection. In the uterus, the main effect is by the sympathetic nervous system, where it produces relaxation of the uterus. Of the liver, because in the sympathetic nervous system is connected with fight or flight, so we need to increase the glucose levels in the blood, and that's why the gluconeogenesis as well as the glycogenolysis will be increased, and this will increase the glucose levels in the blood. In the kidneys, where renin is increased after the sympathetic nervous system activation, and for the fat cells, lipolysis will be induced by sympathetic nervous system. So this table summarizes the effects on the previous slide as well as adding these effects. Now this table is very important as well in showing the mechanism of action by which sympathetic nervous system and parasympathetic nervous system produces their effect, and what type of receptors or subtypes that are responsible for producing these effects. For example, if we look at the heart, the receptor of sympathetic nervous system that's responsible to produce this effect are beta cells, and specifically beta 1. The effect on the vascular effect of the sympathetic nervous system is mediated through two receptors. It will constrict the blood vessels through the action on alpha 1, but also we have the action of beta 2, where it can relax these smooth muscles of the vascular system. The beta 2 mainly are present to the blood vessels that go into the skeletal muscles, so that will increase the flow of blood full of oxygen to these skeletal muscles that are needed for the fight or flight effect. However, the alpha 1 is located into the blood vessels going into the skin and the viscera, and during fight or flight they are less important compared to skeletal muscles, and that's why they produce constriction to decrease the blood flow toward them. In the bronchial tree, for example, we have beta 2 receptors for the sympathetic nervous system, as well as we can see the effect or the receptors and their subtypes on other tissues, as we see here. On the other hand, the parasympathetic nervous system is mediated mainly through the muscarinic receptors. We have 5 subtypes of muscarinic receptors, and also we can see here the type of the subtype on each tissue to produce their effect through the parasympathetic nervous system. An example is the heart. Here is the subtype is muscarinic 2 that will produce to decrease heart rate or bradycardia. Now also please look here at the sweaty glands, which only innervated by the sympathetic nervous system, where it's increasing through the mediation of the muscarinic receptors, and this is the exception I mentioned in the previous slide. Let's come back to this slide again. This simple slide that summarizes everything. We have the central nervous system that sends the preganglionic neuron in both parasympathetic and sympathetic nervous system. They will release acetylcholine in the ganglia, where they will bind to the postganglionic neurons, where they send their axons toward the different tissues of the organ. In the case of sympathetic, it will release mainly norepinephrine to the target organ. We already talked about one exception, which is the innervation of the sweat glands, where they will release acetylcholine, while in the case of parasympathetic, they will release acetylcholine that binds to different receptors at different organs. For the final slide for this presentation, this slide also summarizes everything we talked about. So for the somatic nervous system, which is responsible for sending neurons into the skeletal muscles, the neurotransmitter between the neuron and the muscle, or what's called the neuromuscular junction, is the acetylcholine. It binds to nicotinic receptors on the skeletal muscle. This is a voluntary movement, and this is different than the autonomic nervous system, including the parasympathetic and the sympathetic nervous systems. In the parasympathetic nervous system, preganglionic neuron go to the ganglia, where it secretes acetylcholine that also binds to nicotinic receptors, where then postganglionic neurons send their axons toward the target tissues, and they release acetylcholine that binds to muscarinic receptors. 5 subtypes of muscarinic receptors. For the sympathetic nervous system, we have 3 scenarios. The first one and most common is the preganglionic neuron will release acetylcholine toward the postganglionic neuron binding to the nicotinic receptors, where it then sends their axons toward target organs, and norepinephrine is released and binds to alpha or beta receptors. An exception to that rule is the release of acetylcholine from postganglionic neurons to sweat glands, where they bind to muscarinic receptors. A second exception to that rule is the innervation of the adrenal medulla, where the preganglionic neurons themselves will reach the adrenal medulla. They will release acetylcholine. It will bind to nicotinic receptors and will activate the adrenal medulla to release epinephrine and norepinephrine into the blood. One last point here is that nicotinic receptors located into the ganglia of parasympathetic and the sympathetic nervous system, as well as in the adrenal medulla, is considered as N-nicotinic subtype receptors that's specific for the ganglia, which is different than the nicotinic receptors that are located into the skeletal muscles of the N-M subtype. At the end of this presentation, thank you so much for watching, and please let me know your questions in the comments below.